Welcome to the deep dive. Today we're tackling something really important, a danger that might be sitting in your house or garden right now. Lily and daylily poisoning in cats.
hmm
We've looked at some key sources on this, and really our mission today is just to give you the essential info you need to keep your cats safe from these plants.
And it's incredibly urgent. Even a tiny nibble of these lilies or daylilies, it can be devastating for a cat.
Devastating. How?
We're talking potentially lethal. And it happens fast, really fast.
Mm.
So understanding the risks, knowing the signs, it's just vital.
Absolutely vital. Okay, so if you have a cat, or maybe you know someone who does, you need to hear this. We'll break down what makes them so dangerous, try to keep it clear.
Yeah, let's do that.
Okay, so first things first, which specific plants are we actually talking about, the culprits?
Right. So the main ones belong to the Lilium genus. That's things like Easter lilies, tiger lilies, those Japanese show lilies, rubrum lilies, lots of hybrids too.
Okay, the classic Easter lily. Got it.
Exactly. And then there's the Hemerocallis genus. That's all your daylilies. So yeah, those really pretty flowers we love having around, they're the ones.
And it's not just the flowers themselves that are the issue, is it?
No, that's right. Every single part of these plants is toxic to cats. But, realistically, it's the leaves and the flowers they're most likely to chew on.
Okay.
And what's really striking, you mentioned this earlier, is the difference between species. Cats, severe kidney damage. Dogs, they might get a bit of mild gastrointestinal upset, maybe some vomiting, but usually nothing near as serious.
Wow, that's a huge difference.
It really is. It just shows how, what's fine for one pet can be incredibly dangerous for another. You always have to check things out specifically for the animal you have.
That's such a crucial point. Okay, so we know which plants. Do we know why they're so toxic? Like, what's the actual poison?
That's the tricky part. The exact toxic compound. It hasn't actually been fully identified yet.
Really?
Yeah. But what the research does show is that the toxin is in the water-soluble parts of the plant.
Water soluble. So does that mean?
Well, it means that even just drinking the water from a vase that's had lilies in it could potentially pose a risk. Although, realistically, eating the plant itself is the main worry.
Okay. Still good to know about the water, too.
hmm It does make you wonder, though, if they'll eventually pinpoint exactly what it is and how it works.
Yeah, definitely. Okay, so tiny taste, potentially lethal, all parts bad news for cats. Let's talk about the timeline. If a cat does eat some,
Hmm.
what happens? What are the symptoms we need to look out for? Say you find chewed leaves. What's next?
Right. Well, unfortunately, things can move alarmingly fast. The very first thing you'd likely see is vomiting. Sudden vomiting usually kicks in within maybe 2 hours or so after they've eaten it.
Okay, vomiting first.
Yeah. And here's a potentially misleading part, that vomiting might stop for a bit, maybe after a couple of hours.
Oh, so you might think they're okay.
Exactly. You might think, oh, phew, danger passed. But it absolutely hasn't. That's a sort of false sense of security.
Okay, that's scary. So, the vomiting might pause. What comes next? What else would you see?
Around the same time as that initial vomiting, or just after, the cat will probably get really quiet, lethargic,
Mm,
might hide away, and they'll lose their appetite completely. Anorexia, we call it.
right.
And those signs, the quietness, the not eating, they tend to persist right through the whole thing.
Okay.
And
Great.
then,
Yeah.
within about 12 to 24 hours post-ingestion, you might notice the cat starting to drink a lot more and urinate a lot more. That's called polyuria.
Increased drinking and peeing.
Yes. And because they're losing so much fluid, they start getting dehydrated. You might see sunken eyes. Maybe their gums feel a bit sticky.
Okay.
And this is a really, really critical point,
Okay.
because this stage, this polyuria and dehydration, can very quickly lead to the kidneys failing completely. Acute kidney failure, where they stop producing urine altogether. That's a renal failure.
Wow. So quickly.
It really drives home that you just can't wait and see with this. Time is absolutely critical. Every hour matters.
Okay, so that's within the first day or so. What happens after that, if things continue?
Well, by about 36 hours in, the vomiting often starts up again.
Oh, it comes back.
Yeah. And this time, it's usually coupled with increasing weakness. The cat might seem wobbly, unsteady, doesn't want to move much.
Okay. Getting weaker.
Right. And then over the next day or two, so within maybe 2 to 4 days total, the cat might become recumbent,
Mm.
unable to stand up at all.
Oh, that's awful.
It is. And sadly, if treatment isn't started, this poisoning can lead to death, usually within about 4 to 7 days after eating the plant.
4 to 7 days, that's terrifyingly fast.
It is terrifying. And as pet owners, I mean, the thought of that is just, yeah, it's awful. It really shows why immediate action is just non-negotiable.
Absolutely. Okay, let's think about how this happens. How do cats actually encounter these lilies? What are the big risk factors?
The number one thing, the absolute key thing to remember, any ingestion or even suspected ingestion of a Lilium or Hemerocallis plant by a cat is a potential emergency. Full stop.
No, Sarah.
No safe amount whatsoever. And interestingly, you might think indoor cats are safer, but sometimes they can actually be at higher risk
How so?
because new things, like a bouquet of flowers or a potted plant, suddenly appear in their environment. They get curious, they investigate, they might nibble. An outdoor cat might have more distractions or might ignore ornamental plants they see all the time.
Ah, okay, that makes sense. So those beautiful flowers we bring inside.
Exactly. Cut flower arrangements are a really common source.
Yeah.
Or potted lilies, maybe given as a gift. They look lovely, seem harmless, but for a cat owner, they're a potential hazard right there in the living room.
Yeah. Knowing those symptoms, you really start thinking about where the exposure could come from.
Mm-hmm. Very common sources.
Okay, this paints a very clear and frankly worrying picture. Let's go a bit deeper. What's actually happening inside the cat's body? You mentioned nephrotoxic syndrome, kidney poisoning. What does that mean on a sort of cellular level?
Right. So nephrotoxic basically means poisonous to the kidneys. The toxins in these lilies and daylilies directly attack and damage the cells inside the kidneys, specifically the cells lining what are called the renal tubules.
Well, tubules, what do they do?
They're absolutely essential. They're a key part of the kidney's filtering system, responsible for processing waste from the blood and making urine. So when these cells get damaged by the toxin, they just can't do their job properly.
Okay.
And that disruption, it sets off this cascade of really serious problems. It's like the kidney's internal cleanup crew just gets poisoned and stops working.
And I assume vets can see signs of this damage in blood tests. What kind of things show up?
Oh, yes, absolutely. Blood work is crucial. You'll often see really high levels of BUN, that's blood urea nitrogen, and also high phosphate and potassium levels.
Okay.
And creatinine, which is another key marker for kidney function that usually shoots up dramatically. We're talking levels like 15 to 29 milligrams per deciliter, sometimes even into the 40s in really bad cases.
Yeah, wow, that's high.
Extremely high. These are basically big red flags saying the kidneys are in serious trouble. They're failing to filter waste products out of the blood. And sometimes a bit later on, you might also see liver enzymes like AST, ALT, ALP start to increase too, suggesting the liver might also be getting affected.
So it can spread beyond the kidneys eventually. What about the urine itself? What does that tell the vet?
Urinalysis is also really informative. You often see severe proteinuria. That means lots of protein leaking into the urine, kind of like the kidneys filters are damaged and letting things through that shouldn't get through.
Right.
You might also see glucosuria, glucose or sugar in the urine, even if the cat isn't diabetic, and the urine-specific gravity will be low. That means the kidneys have lost their ability to concentrate urine properly.
Okay.
And then, looking under the microscope, a key finding is seeing lots of what we call tubular epithelial casts. Yeah, they're basically little clumps or molds formed from damaged kidney tubule cells that have been shed into the urine. Seeing those is direct evidence of injury happening right inside those kidney tubules. It's a very specific sign.
So direct evidence of the damage.
Exactly. And interestingly, you usually don't see crystals in the urine crystalluria, which can be a cause of other types of kidney issues. That helps differentiate sometimes.
Okay. Any other internal signs to be aware of?
Well, in cases where a cat might have eaten a really large amount of the plant, you could potentially see increases in amylase and lipase too, which are enzymes usually linked to the pancreas. But honestly, the main focus diagnostically is almost always that severe kidney damage profile.
Got it. This detail really shows just how badly the body is affected. So if a cat comes in with symptoms like these, how does a vet actually confirm it is lily poisoning and not something else?
Well, it often starts with a really thorough history from you, the owner. If there's any chance the cat got into a plant, telling the vet is crucial. And if possible, bringing the actual plant in is incredibly helpful.
Could check it.
Yeah, so the vet can look for chew marks and, more importantly, get it properly identified. Sometimes they might even consult a plant expert, like a horticulturist, to be absolutely sure what species it is.
Okay. And you mentioned other things can cause similar symptoms. What are vets trying to rule out? What are those differentials?
That's right. It's important because several things can cause acute kidney injury. They need to consider other toxins, things like certain human painkillers, aspirin, NSAIDs,
Right.
heavy metals like zinc or mercury, common poisons like antifreeze, that's ethylene glycol or boric acid, Even certain antibiotics like aminoglycosides or those food contamination incidents we heard about with melamine and cyanuric acid.
Wow, quite a list already.
And that's just the toxins.
Hmm.
We also have to think about underlying medical issues presenting acutely, like maybe chronic kidney disease that's suddenly gotten much worse, or a urinary blockage, or immune system problems affecting the kidneys. Even infections like leptospirosis or pyelonephritis, a kidney infection, or sadly, cancer like lymphoma.
Okay, so it's definitely not always obvious.
Not at all. That's why the history, knowing about potential plant exposure, is just so incredibly valuable for the vet to narrow things down and start the right treatment fast.
Which brings us to treatment. Once lily poisoning is suspected, how vital is speed? What's the immediate plan?
Speed is everything. Cannot stress that enough. Early decontamination makes a huge difference to the outcome,
Decontamination meaning?
getting rid of any plant material still in the system. Even though the cat often vomits on its own, the vet might induce more vomiting if it's safe and appropriate for the timing, and they'll likely give activated charcoal.
To soak up toxins.
Exactly. It helps bind any remaining toxins in the stomach and intestines. Often it's given with a cathartic, like sorbitol, which is a mild laxative, just to help move everything through the system more quickly.
Okay. And what about protecting those kidneys from shutting down completely?
That's the absolute cornerstone of treatment. Early, aggressive intravenous fluids, 4V fluids. Ideally, this needs to start within 18 hours of the cat eating the plant. That's the window to try and prevent that anuric kidney failure from setting in.
18 hours. That's not long.
It's really not. And the fluids are given at a high rate, usually about 2 or 3 times the normal maintenance rate, for at least 24, sometimes 48 hours or more. It's all about flushing the system and supporting those kidneys.
And what if? What if it's too late for that? What if the kidneys do start producing urine, despite the fluids?
In those very severe cases, unfortunately, the main option left is dialysis.
Like human dialysis.
Essentially, yes,
Yeah.
hemodialysis.
Yeah.
It takes over the job of the kidneys, filtering the waste out of the blood. It's a very intensive treatment, often needing specialist facilities. But some cats have recovered kidney function after about 7 days or so of dialysis therapy.
Wow. That's a major intervention.
It really is. It highlights just how serious this poisoning is.
Are there other key things vets need to watch out for during treatment? Specific do's and don'ts?
Yes, definitely. One big one is avoiding IV fluids that contain potassium. Cats with this kind of kidney injury often have dangerously high potassium levels already, so adding more is risky.
Okay, no potassium fluids.
Right. And also, any drugs that are normally eliminated by the kidneys need to be avoided or used very, very carefully because the damaged kidneys just can't process them properly.
Makes sense.
And another point, diuretics, those drugs that make you produce more urine, they generally don't help once the kidneys have already shut down and stopped producing urine. They can even be harmful in that situation.
Right. Okay, so early aggressive fluids are the best bet. What happens after that initial critical phase? What's the follow-up like, and what's the outlook?
Well, continued monitoring is essential. Keep checking those blood tests, the kidney values, especially if the cat needed dialysis. And remember how we talked about that polyuric phase where they urinate a lot?
Yeah, leading to dehydration?
Exactly.
Yeah.
That dehydration seems to be a key step needed for the kidneys to progress to the anuric stage, where they shut down. So if we can intervene early with fluids and prevent or correct that dehydration,
You can potentially stop it from getting to the shutdown stage.
that's the hope. We can often halt the progression right there. And in those cases where we manage to prevent complete kidney shutdown, the prognosis is actually much better. Kidney function usually starts to return to normal gradually, maybe within 24 to 48 hours, with continued supportive care.
That is hopeful. It really underlines how critical that early intervention is.
Absolutely. Swift action makes all the difference.
Okay, so let's bring this all together. If there's one main message you want people listening to take away today, what is it?
It's just crystal clear, really. Lilies and daylilies are seriously, potentially fatally dangerous to cats, period. If you even think your cat might have nibbled on one, even a tiny bit, treat it as an emergency. Get to a vet immediately. That gives them the best possible chance.
Yeah, and it really just highlights how vigilant we have to be, doesn't it? You need to be aware of every plant in your home, in your garden, even bouquets people bring over. If you have cats, really think hard about choosing safer, non-toxic plants instead.
Definitely. It's a bit of a wake-up call, perhaps. You know, this whole deep dive shows how things that seem perfectly harmless in our homes can pose these hidden, serious risks to our pets.
It really does.
Makes you wonder, doesn't it? What other everyday items might be unexpectedly hazardous for them? And, where can people find reliable information to make sure their home environment is truly safe for their furry family members?